Hi, this is Justin in partnership with Rolling Out Health IQ, and I'm here with Charles T. Folsom
Mhm.
Jr., actually. Charles, how are you doing today?
Good, good. How are you?
I'm well, I'm well. Can you give the community a little bit of background on what you do for a living?
So, I am a registered nurse. I work with Emory Healthcare in the emergency department, and I also own a owner and founder of Elife Technology, which is a new app development for first responders.
Can you talk more about the application and what it does?
Oh, yes. The application is designed for first responders. It's a mobile application that's on Apple and Android devices. And we also attach it to wearables, like you can see on my wristband here. And it allows first responders to be able to tap and get information on you within 4 seconds, which helps with the pre hospital treatment for patients, as well as changing the clinical outcomes. And we're one of the first companies in the country to do it.
Wow. So, can you talk more about your journey as a nurse to then also as an owner of a healthcare AI IT product? That's pretty cool, right?
Yeah, exactly. So I've been a nurse for 37 years. My journey was long. I had to pay for my own education. So I was working as I went through school. But I did my undergraduate at Jacksonville University. And then I went on to Georgetown to do a master's degree in managing health systems. And from that point, I kind of went into the corporate world and worked pretty extensively.
And so how has that experience kind of helped you navigate? I mean, it's one of those things where you're in the nursing sector, you're seeing patients, you're in the field, but then it's like, what spurns you to say, hey, like maybe I should do this, or there's an opportunity.
Yeah.
Now it's not a maybe. It seemed like an opportunity to do something in IT. And even then, as AI, artificial intelligence, kind of takes hold, even pursuing that, right? And staying kind of up to date with the latest trends. I mean, what are your thoughts on that?
So, when you actually work in operationally in healthcare, you see so many things that are nuanced that people don't really understand it going behind the scenes, and the complexity of disease and the complexity of practicing as a clinician. It can be quite daunting on people. And when we see outcomes of patients that we know could have been changed by having information available, that was the biggest prompt for me to go in and say, hey, we've got to fix this problem. Because I can't tell you how many times that mama or your auntie shows up in the emergency department with a bag full of medications and they may be having a stroke, and they think that we can just magically fix it. But you've got to realize, if you're treating a complaint without context, it can be very dangerous, because the third leading cause of death in the United States is medical errors.
Wow,
And
that's
yes,
amazing. Whoa, so the third leading cause of medical of death is medical errors.
that's correct.
Wow, wow. So then the next question, and maybe a lead on into this, how's your perspective of as an African American in the healthcare setting influence your perspective as a healthcare entrepreneur?
Okay. So this is not private information. Health disparities exist. I can't tell you how many times there's a sickle cell patient come in, and the doctor who doesn't understand culturally that, this is a real disease that's affecting real people's lives, will order Tylenol when we know that their bodies have to have opioids in order to manage the disease process. And now they even have genetic markers that show that certain individuals, especially of African American descent, have the ability to process opioids at a faster rate than other people, which means their bodies ability to maintain pain free is less than other people who are non-African. So the data really shows that there are big, gigantic disparities in healthcare as far as the way patients are treated, and the actual the differential diagnosis is being concrete and accurate. Because we see a lot of that happens, that they're young, they can get over the flu, they can get over a cold, let them go home and shake it off, and then the patient comes back with pneumonia and end up in the ICU.
Wow,
So we
wow.
know these things exist. This is not our imaginations.
Right. And so the disparities, what you're saying is it's actually reversed, right? African Americans could feel pain a little bit more so
Yeah,
than others. And then combined with the lack of access or quality care, and these like, preconceived notions that are inaccurate is
yeah.
actually detrimental to our communities.
It's extremely detrimental. But that plays a part in understanding the diversity and the culture of the individuals that come into our hospitals. And that's our job. That's our oath, is to make things better for the patient. And we have to meet them where they are. So, for instance, in certain cultures, women don't speak. So, if a woman comes in with a complaint and I have to go to her husband or the male figure in her life to really give me the explanation on what's going on with her to get that accurate information. But that's a bridge that I have to, put myself to cross in order to get the information to make it accurate to improve the outcome. The same courtesy should be offered to us as African Americans, that there's no assumptions made. He's a big burly guy, so he has the strength to overcome it. That's not what practicing medicine is, but that's what we see a lot of.
So then I'm gonna switch gears. What skills or insights that, from your healthcare background basically played a major role or helped you the most when thinking about becoming an entrepreneur? And the reason why I asked is that because, with technology and healthcare and the ability for us to improve outcomes, there's opportunities that present itself, right?
Yeah.
But then, like, so what skills do you think people should basically what skills did you think helped you the most in helping you become an entrepreneur?
Um, Exposure and understanding process and integration. Those are the biggest things. People overcomplicate things. Everything that we do in life has some process, tasks, steps, and things that we do. And looking at being able to determine the outcome and regressively look back and say, hey, how can I change this strategy to create the outcome I want, is a vital skill that you must have in being an entrepreneur. Adaptation is the key. If you can't adapt, you don't even get started in it. You've got to be able to look and see what the market desires. What's the product, intended use of your product delivering to the client? And is it something that they can digest, or is it something that's going to take a lot of effort for you to get them to be able to see the benefit of it? And that's what we've done with our product and iterations to change it to be more user friendly on the front end for end users, and to make them understand the benefit of using it when they take that information to the hospital and being able to show their stuff on their phone or have it be on a device that they can use. That information in seconds changes the perspective of the caregiver when the patient enters the facility.
What are some of the challenges you faced in both nursing and then also for your business?
Nursing challenges is the biggest thing is assume perspective of who you are. A lot of times you won't be deemed as intelligent as other people, or we have to second guess his work. And keep in mind, I've worked everywhere from the emergency department at Grady. I've worked in the intensive care unit at the Veterans Administration. I've recovered open heart patients. So I've gone through a gamut of the most intense clinical settings that you can practice in. And having to overcome or go into a room and the patient asks you, where did you go to school? As if the school you went to wasn't legitimate. That can be, it's not really frustrating because you realize people just operate a lot of times in their level of ignorance, but having to prove yourself over and over and over again shows the resilience that we have as African Americans, but it can be frustrating a lot of times. And in the entrepreneurial world, the biggest challenges we face as African Americans is collaboration. Our product is self-funded, so we have zero debt. We've got revenue, we've got subscriptions. Collaborating has been the biggest issue because we do not believe we have the ability to deliver a quality product to each other based on assumptions about each other.
Mm.
And that's one of the biggest hurdles we have to overcome. Like we're working now with Fort Valley State University because MIT has a program that helps them do app development. So we're having them work on our AI component of our application. But we have to give each other the opportunity to shine because we've proven that we run the busiest airport in the world. We've proven that we've led the way for multi-billion dollar companies to exist with innovation that a lot, in many cases, is our innovations. But we don't trust each other to deliver that quality product to each other.
Mm. And so, switching gears now to technology, you seem like a technologist, an AI maven, a healthcare guru in your own right, but also a community leader. What excites you about the healthcare landscape now? I mean, you've developed products, you've been in the operating room, the artificial intelligence is here. What are some of the exciting things, and what does the future of patient care look like?
The ability to customize care is going to be so vast that I would predict in 5 years, people will have the ability to live to be 100 or more.
Really, really cool. Really,
Yeah,
really cool.
because now we're using AI to actually do gene matching for transplant patients. That's a game changer. So no longer are you guessing about whether the metrics go together. You've got the ability to do models for probability of rejection, um, compatibilities. The DNA is just, it's incredible. What the future offers through technology is just mind blowing right now.
And so, question for you then. We talked about collaboration. That's one point of um, improvement for the African American community. What other advice would you give to African Americans who are in a current space? They have a passion for healthcare. They
Mhm.
may or may not be in healthcare, but they want to use business and products and their vision and their ingenuity to basically heal the community through entrepreneurship. What advice would you give them?
Connect with all of your leaders in your community, even if they don't collaborate with you. Continue to press those relationships, build those relationships. And the thing that we've seen is that initially there was a lot of resistance or people were skeptical, but now that they see that we're delivering a real product that has real results and patients are begging for it, now we're getting the traction that we need. And for us, this is more than a business, it's a ministry, because at the end of the day, I'm the one, I'm experiencing seeing people die over things that they could have easily changed. Diet modifications, exercising, understanding disease processes, which is one of the big things that I do in coaching and coaching individual patients. But they got to understand that uh, it's a saying that I have is called, man will be forced into health compliance through the manifestation of disease. So at some point, you're going to have to adhere to the changes you need to make to survive, or the disease will overwhelm you.
Charles, could you give the community a little bit more information about your product, where they can find you on social media, the name of the product, that type of thing?
So the name of the product is Elife Health Summary, and we're on Instagram, we're on LinkedIn, and you can go to the website, and it's just ELIFE Health Summary, elifesummary.com. You can go to our website. It has everything on there. It's got videos, it's got testimonials from individuals and patients, as well as providers. We're trying to put the power in the patient's hands to be able to make informed decisions. And that's the biggest challenge, is that patients think that their doctor has all of their information. And I'm like, honey, your doctor's in Aruba and it's 2 o'clock in the morning and you might be having a stroke or a transient ischemic attack or a heart attack. And we need that information now. We need it from pre-hospital as well as hospital. So uh, just going forward, man, we're excited about what the future holds and working with communities of color.
Thank you so much, Charles. I really appreciate your time and your product, your business, and your stewardship in healing the community. Thank you again.
Thank you.